Welcome back to the Remdesivir Files, a COVID-19 chronicle. In today's episode, we dive into how clinical pharmacologists assess the marginal benefit of remdesivir in treating moderate versus severe COVID-19 cases, focusing on cost, effectiveness, and risk. Saakshi Sharma, thank you for joining us.
Thank you for having me. The risk-benefit analysis is key in assessing any drug, and for remdesivir, it becomes even more critical during a pandemic.
How do clinical pharmacologists approach the risk-benefit analysis when evaluating remdesivir for moderate versus severe COVID-19 cases?
In moderate cases, pharmacologists weigh whether the time to recovery benefit justifies remdesivir's cost and potential side effects as well. If the patient is likely to recover without aggressive treatment, the drug may not offer a significant advantage. In severe cases where the patient's condition is worsening rapidly, the drug's benefit in reducing recovery time can outweigh the costs and risks, especially in patients requiring oxygen or at risk of ventilator support.
What specific metrics do pharmacologists use to evaluate the marginal benefit in moderate cases?
Pharmacologists focus on time to recovery as shown in trials like ACTT1. They also assess oxygen saturation levels, inflammatory markers like CRP, and whether the patient is at risk of deterioration. If the patient shows early signs of worsening disease, remdesivir may be considered to prevent progression. But the cost and potential side effects must still be factored in.
How is the risk-benefit equation different when treating severe cases of COVID-19?
In severe cases, remdesivir's benefit becomes more pronounced due to the higher risk of progression to critical illness. Pharmacologists evaluate time to recovery and whether earlier intervention could reduce hospital stay. The decision to use remdesivir often depends on how early it can be administered and also whether the potential side effects like liver or renal issues are manageable compared to the benefits of faster recovery.
How do pharmacoeconomic models help with these decisions, particularly in the context of limited resources?
Pharmacoeconomic models such as cost-effectiveness analysis and cost-utility analysis help assess whether remdesivir provides enough benefits to justify its cost. These models calculate the incremental cost-effectiveness ratio, or ICER, comparing the cost of the drug to the benefit in terms of quality-adjusted life years, which is QALY, or the hospital stays. In severe cases, if the drug can reduce hospitalization time, it might justify its high cost, especially when resources are scarce.
Thank you, Saakshi, for providing these crucial insights into the risk-benefit analysis of remdesivir in COVID-19 treatment.
It was a pleasure to discuss the complexities of clinical decision-making during such a critical time. Thank you for having me. Stay tuned. See you in the next episode.